what is knee osteoarthritis and what types of symptoms do patients experience?
So osteoarthritis is a common condition that affects the joints.
Okay.
It's basically has to do with inflammation inside of those joints. The most common joint that's affected is the knee.
Okay.
So as we get older and as we use our joints, the cartilage inside of the joint starts to break down. As that cartilage breaks down, it releases chemicals, and these chemicals and these enzymes lead to basically a vicious cycle whereby there's further cartilage breakdown and inflammation. That inflammation can be a source of severe pain. And when patients develop debilitating pain related to osteoarthritis, knee pain, it can really, present a challenge for them in their mobility, in their ability to kind of do their activities of daily living, and kind of affects their entire life. It typically comes on at around the 5th or 6th decade of life. So as we continue to kind of use our joints, the osteoarthritis sets in.
Mm-hmm. And what's the typical plan of treatment as opposed to kind of what you offer?
Sure. So, if we kind of look at the landscape of how this condition is treated, it starts off with conservative medical therapy. So these patients are seen by, their internal medicine physicians, their family practice physicians, and then they may be referred to things like physical therapy. Exercise and weight loss can help a lot because we know that, as you put on more weight, there's more pressure on those joints. Mm-hmm. So these sorts of things are kind of the earliest stages of what we would do in the conservative therapy. In some patients, they may require to be taking medicines like ibuprofen or Tylenol. These are anti-inflammatory, non-steroidal anti-inflammatory medicines, NSAIDs. And then in severe cases, sometimes they do end up getting on stronger pain medicines. That's sort of the first step. After that, patients may be eligible for things like joint injections, which are very, very common in the United States. Mm-hmm. The types of injections they might be getting is injection of things like corticosteroids. Mm-hmm. So steroids reduce inflammation, and they're injected directly into the joint. Mm-hmm. There are also newer things that you can inject into the joint, like gel, which helps to cushion the joint, as well as other newer things like stem cells and something called PRP. So that's kind of the initial progression of how we kind of treat things. Now, on the complete opposite side of the spectrum would be something like knee replacement. Okay. So knee replacement has been around for a long time. We know it works. It's a very effective therapy, but it's typically reserved for patients who are in the most severe stages of osteoarthritis. And you have to it is considered a major surgery, so one would have to be relatively fit medically in order to undergo this type of surgery. Okay. Now, for patients who have maybe tried joint injections and physical therapy, but maybe don't qualify for a knee replacement or maybe don't want a big surgery yet, there is sort of this in-between territory, and that's where this new therapy that we're going to talk about kind of fits into that, called genicular artery embolization.
Okay, so tell us more about that.
So embolization, again, is shutting down, targeted shutting down of blood vessels. Mm-hmm. So when we enter into this inflammatory cascade, this cycle, where you get breakdown of cartilage, release of inflammatory enzymes, this sort of leads to a continual breakdown and a cycle that just kind of goes on ongoing until you can find a way to kind of reduce that cycle. As part of inflammation, you get the growth of new blood vessels. These blood vessels are abnormal, are not meant to be there in your body, and basically contribute to this release of these inflammatory enzymes and this whole cascade. With genicular artery embolization, we target these blood vessels, these abnormal blood vessels specifically in the knee, and embolize them or shut them down. And that breaks the cycle and can lead to pain relief within days to weeks, and sustained pain relief for years.
And you said this would come before a knee replacement, kind of like in that middle area.
Exactly, in that middle area. Patient who has tried conservative therapies that have not worked, and prior to them getting a knee replacement.
Are there things that would rule them out? Contraindications, anything like that would rule them out for this?
There are, just a few. Right now, the type of inflammation that we're treating is mainly in patients who have, again, osteoarthritic type of inflammation. Okay. Now, if you have inflammation in your joints related to something that's not necessarily related to, wear and tear, but things like autoimmune. Okay. For example, rheumatoid arthritis would be an example of that. Mm-hmm. This is an autoimmune condition that affects the joints. This would not be somebody who would be indicated to have this type of procedure. Okay. Another contraindication would be somebody who maybe has an active infection in their joint. Okay. Again, their pain is most likely related to inflammation, related to infection, rather than, again, wear and tear. Okay. So they would need a different type of therapy.
Perfect. What's the success rate of this?
So when we talk about success rate, the first thing that the patients want to know is what's the clinical success rate? I get a procedure done, and am I going to feel better? So, looking at all of the available research and data, we quote to our patients about a greater than 85% success rate, so fairly high.
Okay.
I can tell you anecdotally, our patients do very, very well. The other thing to look at is whenever you're having any type of medical procedure or any type of surgery done, you want to know what's the technical success rate. If I actually end up on the table, are they going to be, successful in doing the procedure? That is close to 100%. So it is a very kind of technically straightforward and type of procedure that we're able to do successfully in almost every single patient.
Awesome. Amazing. What's the downtime?
So, our patients get, up and they're walking immediately after the procedure. A few days of maybe some soreness and, related to just, where we've kind of gone into the artery and what we're treating is normal. But it's really just a few days of downtime.
And how long has this been around that you've been performing this procedure, or that it's been
so
studies?
in the United States, this procedure has actually been performed at major academic medical centers for the last 5 to 7 years.
Okay.
Now, whenever there's a new procedure, there's always a lead-up time. Clinical trials take place in these bigger centers, the data gets published, and then it gets more widespread and much more common. And we are now at the point at which this is much more common in the United States.
Perfect. And you said there's not, the risk is a lot more minimal than with a traditional surgery after?
Absolutely. Yeah. So our downtime is a lot less, and also the complications of this procedure are very, very minimal. Patients can expect a little bit of bruising around the knee after the procedure, but the risk of any kind of serious complication is less than 1% and really not related to kind of what we do.
Now, is this something that's considered cosmetic, or is it covered by insurance?
It is covered by insurance, and we work with patients, their individual insurance carrier, to get pre-authorization,
okay,
to make sure that they are covered. If there are any out-of-pocket costs, we make sure that we disclose that before we move forward with anything.
Well, in talking about being your own advocate, what are the questions that people can go and ask for both of these embolizations?
Absolutely.
What should they make sure they ask their doctor about?
So I think if you're somebody who's suffering from chronic knee pain and you've tried physical therapy, you've been on medicines before, you've tried joint injections, this is another option for you. You can find more information kind of on our website, and you can ask your doctor about this procedure, and have them kind of reach out to us and send us a referral, and we'll be happy to see any patient.
Okay, perfect. And is there anything else you would like to share about these as far as information we didn't talk about?
Absolutely. Well, I think the biggest thing is that, so our center is located in Monroe Falls. We actually have 2 other centers in Northeast Ohio, one in the Beechwood area, it's called Cleveland East Vascular Care, okay, and one on the west side of Cleveland, Cleveland West Vascular Care. These are all part of our preferred vascular group in Northeast Ohio. And at all of these centers, we perform these procedures. So if somebody lives closer to the west side of Cleveland, or maybe on the east side, they can find out more information. And the medical directors there are both interventional radiologists. Okay. Dr. Eric McCloney and Dr. Dan Rocky, both of them have a ton of experience under the belt and can perform these procedures.
Perfect. Okay, so in our last little bit of time left, tell us a little bit about how you got drawn into the medical field.
I'm lucky. I had an aunt who was a physician. She's a vascular surgeon, and she worked a lot with dialysis patients doing fistula creation. And so I kind of just grew up with her, and she and I have an older sister. She and I were both kind of drawn to medicine from an early age, and just seeing my aunt work and seeing the patients that she was really affecting their lives, changing their lives. So my sister became a surgeon, and then I decided also go into medicine. And so it's interesting because they always wanted me to kind of go into the surgical subspecialty, but I kind of had my own path here. But it all kind of comes full circle, yeah.
And do you have any feel-good stories of any success patients that come to mind?
We did a genicular artery embolization recently on a patient, and it was amazing. She went from not being able to do the kind of things that she really wanted to do, which was, things like hiking, yoga, and, we saw her for a 1-month follow-up recently, and she said no pain. In the areas that we treated, there was no pain, and it really feels good. It really feels good to be able to change somebody's life. You know, these are patients who may be of retirement age or getting close to retirement, and they're looking to basically, you know, take back control of their life and enjoy the time that they had. You know, they worked so hard their whole life. Many of these patients, you know, maybe were runners or joggers and want to get back into it. Having debilitating knee pain can really, really change your life, really affect your life. So if I can fix that, if I can take care of that, it's very rewarding. It really is.
I bet it is amazing to be able to see those changes and transformations in people. Well, thank you so much for joining us today. We want to again remind you guys how you can contact Dr. Rajdev, listed below. And if you are in need of any of these services or just more information about these advancements in medicine, be sure to contact them. I am your host, Leah Love, where we have a global outlook from a local view, and I hope you have a wonderful rest of your week. Thank you.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.